Hi. So you've just been diagnosed and you're probably freaking out, but just relax, breathe. It's not all going to happen today.
Michael J. Fox is a leading advocate for people with Parkinson's disease and their families. He knows personally how important it is to take charge of this condition.
And realize that you have a whole life apart from this. You're not you minus Parkinson's, you're you plus Parkinson's.
This program will provide you with information and inspiration from medical experts, their patients, and from a beloved American actor. Michael J. Fox has been living with Parkinson's disease for more than 20 years. When he got the diagnosis, he was already at the top of his profession, a leading actor facing a condition that could affect his ability to move and speak.
It was just so incomprehensible. It was just the last thing I would have expected. So, I was 29 years old. I was worried that the audience wouldn't think I was funny if they knew I had Parkinson's.
So at first, he kept his health issues private, but 7 years into his journey, Michael decided to bring his fans with him.
And they did a really remarkable thing with it. They started to ask questions about Parkinson's, and they started to, and a community started to coalesce around me, and at least let me coalesce into it. And I was young, I did have energy, I did have a public persona, and had a good amount of goodwill.
Michael created a foundation inspiring awareness, advocacy, and action to improve the lives of people living with Parkinson's disease and work toward a cure.
And it just grew into this great example of an opportunity seized.
Michael is one of more than 1 million people in the United States with Parkinson's disease. Relatively few of them first experience symptoms when they're young.
But the biggest risk factor is just getting old. In fact, by the time one reaches the age of 80, 2% of the population at that age will have Parkinson's disease. If you keep living longer, the risk keeps going up.
No matter what age you are, the first step in living with Parkinson's disease is to learn about what it is and how it might affect your future. Doctors and researchers continue to explore possible causes for Parkinson's disease. What is known is that Parkinson's disease is linked to an important chemical messenger in the brain.
And that chemical messenger is called dopamine. It's important for movement. It's also important for motivation, probably for mood and other behavior problems.
When the brain cannot produce enough dopamine, the symptoms of Parkinson's disease may begin to appear.
The most common symptom that people recognize is tremor, particularly that tremor, what we call tremor at rest. If you look at my hand's at rest, there's a tremor.
And then slowness, or difficulty making movements that are normal in speed and size.
It starts out very mild symptoms, and the disease tends to get worse over time.
Parkinson's disease cannot yet be cured, but treatment can help reduce symptoms. Today, people with Parkinson's disease may lead full, active lives for many years.
What you are going to deal with is what you have been dealing with unbeknownst to you for months, years previous probably.
Caroline knew that something wasn't quite right, but she was busy with a new career. After raising 2 children, she had just earned her nursing degree.
I started noticing symptoms about 6 months into my first job, and the symptoms I noticed were kind of my arms got real stiff. I would walk kind of like this with my arms, and I had a pinky tremor, little tremor, pinky, and this one too.
Caroline went to one healthcare provider after another, but none of them pointed to Parkinson's disease.
I went through several doctors, had all kinds of testing done, and after 2 years, I finally got a diagnosis.
Parkinson's disease is not revealed by a blood test or an X-ray. Instead, the doctor looks for classic symptoms: tremor when a limb is at rest, slow movement in the arms or legs, stiffness of the arms or legs, and loss of balance.
The diagnosis of Parkinson's disease depends on the physical examination. And if you look for these signs, and you need at least something like slowness of movement or tremor at rest and maybe a few other signs, the more signs you have, the more secure your diagnosis is correct. I want you to shrug your shoulders, lift them right up to your ears.
Dr. Stanley Fawn is a neurologist, a doctor with special training in diseases of the brain and nerves. With his special training and his experience in treating Parkinson's disease, in some cases, he can even recognize it in his patients' faces.
They tend to have a flattening of their facial expression because they have decreased spontaneous movements.
Patients or their loved ones might also notice difficulty with fine motor tasks. Handwriting might change. Caroline's husband, Jackie, detected another typical symptom. When they walked together, she was dragging one foot.
When you walk with someone a lot, every day or whatever, you get to know their rhythm. And then one day I noticed that when she was walking, the rhythm was a little different. And I'd hear like, don't, instead of don't.
When Caroline's diagnosis was finally confirmed, it was by a type of neurologist called a movement disorder specialist.
A movement disorder specialist is a neurologist who, in addition to their neurology training, has had special, usually 1 or 2 years, of training focusing on movement disorders. So the majority of their patients, in fact, have Parkinson's disease. And now hold your hands straight out in front.
As we have heard, the symptoms can come on slowly, and the course of the illness varies from person to person. Parkinson's disease, or PD, is a complex condition with wide-ranging effects. Treating it requires teamwork, and good communication is essential.
That is your lifeline, your doctor. So your lifestyle, everything, you have to be very honest. And they need to be honest with you too. They have to take the time to talk to you, and if they don't, you have to insist on it. You have to be your own advocate.
So just take a walk down. I think the important thing about the relationship with the doctor and the patient is that the patient has symptoms of Parkinson's disease 24 hours a day, 7 days a week, every single day. It's really common that when you go to the doctor, you're kind of on your best behavior, you show the doctor your best function, but we're really interested in the person's worst function as well, because we want to get that every hour of the day as good as it can possibly be.
You are the ultimate authority on what you're feeling and what you're going through, and you want to have a neurologist that you can relay that information to, and they'll decode it in the right way and proceed with the treatment that suits it.
Every day, Robert walks from his apartment to his office in the heart of Manhattan.
I've been a New Yorker my whole life, born and raised right here in New York City. New York has everything. All the plays and theater, the museums are fantastic. They're all nearby from where I live, and I enjoy living in New York very much.
But his happy life hit a wall in 2006. As his mother was dying of cancer, he noticed a tremor in his hand.
I just thought it was because of the stress and strain. But after a few months after she passed away, I noticed that tremor was still there, and I said, this has got to be checked out. And I went to a neurologist who said, you're in the early stages of Parkinson's.
Soon after, Robert started taking medication. Medicines for Parkinson's disease cannot provide a cure. Instead, the goal is to manage symptoms by restoring or mimicking normal levels of dopamine in the brain.
Basically what we're doing all the time with Parkinson patients, because the disease tends to get worse over time, is staying on top of the disease symptoms and treat accordingly.
The medicines for treating PD symptoms include levodopa carbidopa, which works by temporarily restoring the supply of dopamine to the brain. There are also other PD medications. COMT inhibitors are used to extend the action of levodopa. Dopamine agonists mimic the effects of dopamine in the brain. MAOB inhibitors slow the breakdown of dopamine in the brain, making more of it available. Anticholinergic medicines and amantadine may be used to help control the tremor that many PD patients experience.
We often use medicines that have more modest effects in our patients with mild disease as a first start. And then over time, as the person feels like they need more help to get by with their daily functions, for example, then we will escalate to more powerful medicines.
It's really good news. I don't see any worsening of your Parkinson's symptoms.
Robert sees his neurologist on a regular basis. Together they review how his treatment plan is working and decide if any changes are needed. Side effects are a key part of the discussion.
And the drug that was causing me to have periods of drowsiness, so far so good.
All the drugs we use for Parkinson's can cause side effects. Ready for the pull?
Some side effects may require additional medicine to manage. Whatever medication you're taking, be sure to take it as directed. If it doesn't seem to be working, don't wait to get in touch with your healthcare provider.
Whatever symptom bothers the patient the most, we try to address that particular problem. And if we don't communicate with the patient, we're not going to find that out.
One option for some people with Parkinson's disease is deep brain stimulation, or DBS.
It calms down those overly active areas of the brain, but does it with electricity rather than medication.
They insert into the brain at a specific target an electrode that they activate through a battery, and they send signals to that, and it stimulates that target in the brain.
Your neurologist or movement disorder specialist can help you determine whether this is a treatment you might consider. You might also ask whether you're a candidate for clinical trials, becoming part of research to test potential new treatments. Advocates for the Parkinson's community say finding people to participate in research is an urgent challenge. By joining a trial, you can help. The quest for a cure depends on clinical research. There is more information on the Michael J. Fox Foundation website.
And we have a thing called Fox Trial Finder, which exists for people to plug in their information and see what trials are available for them to get involved in, because they may be really valuable participants in clinical trials. So that's my pitch there. I always say, if you imagine the worst case scenario and it happens, you've lived it twice. So don't go there. Just be in today and do what you need to do to live a full life today.
John's life just seemed too full to handle a diagnosis of Parkinson's disease. He and his wife Barbara have 5 children. His job as a carpenter requires physical strength and agility. When he started feeling symptoms, he told Barbara it was probably an old injury acting up, a pinched nerve.
She says, I don't think it's a pinched nerve. So I want you to go get it checked. I go, why? What do you think it is? She says, I think it's start Parkinson. Because she said my gait was different.
Barbara is a nurse, so she recognized the signs. The movement disorder specialist agreed it was not a pinched nerve.
She's like, no, I hate to tell you this, but it's Parkinson's. So I think I knew it all along, but hearing it is hard.
It's like, I had a house drop on me.
But John has discovered that life continues. He is not yet on medication, but he has stepped up his exercise under his doctor's supervision.
In my experience, people who are physically active do better than people who aren't. So that I recommend that my patients find a way to be physically active at least 30 minutes a day. Whatever it is that they find enjoyable, that they can stick with, that they can do safely and effectively, that's a good thing.
Helping Dad get his exercise can be a benefit for the whole family.
So it's really helped us. It's helped us get our kids more active too. So we're all getting healthier.
Whether it's hoops at home, swimming, or a trip to the gym, the key is for patients to find something they can do on a regular basis.
So if they like to jog, that's great. Play tennis. Ping pong is a very good exercise even for elderly people. Dancing, take your spouse dancing, it's always good. Even gardening, walking, whatever the person likes.
I'm at the gym as often as I can, and I enjoy it. And I also do yoga. I'm terrible at it, but I do yoga on the weekends.
Whatever you choose to do, check with your doctor first. You might ask about getting physical therapy for help with balance and strength. Robert has also talked with his doctor about getting therapy for his voice.
It's interesting that one of the problems patients have is that they perceive that they're speaking more loudly than they are. So they think that they're shouting even, and yet the people around them tell them they can't be heard.
My brother's girlfriend says, make believe you're talking to the taxi cab driver, because she said whenever you do that, your voice projects. So
if you ask a person to shout, they can shout. But a person with Parkinson's tends to naturally just move slower and talk softer. And so there's a special voice treatment technique that can teach a person how to raise their voice and have it raised all the time.
There is no special diet for Parkinson's disease patients, and vitamin supplements are not necessary unless your doctor recommends them. But it is always a good idea to make healthy food choices, and be sure to ask your doctor about any alternative treatments you are considering, such as supplements, acupuncture, or massage.
Well, massages helps a lot of things. It certainly relaxes one, gets rid of the muscle tension, and it might be good, but it's only lasts as long as that massage lasts.
It helps to loosen the muscles up, and but I have to admit the effects of a good massage are like acupuncture. It's transitory. It doesn't last very long.
So my approach is that patients try the things that they're interested in, and if they feel that they're making a difference for them, that they then continue that.
People with Parkinson's disease may also benefit by connecting with other patients through a support group in person or through the internet. Caroline takes that a step further. She shares her story online through her own blog.
You communicate instantly with people all over the world, and I can complain, I can be creative, and I love to be in touch with people. I think anything that pulls me out of myself and my own feeling sorry for myself thing is great. Yeah. So I have a great time doing the blog. Yeah.
I thank them ahead of time for what they're going to do, because I know my family is everything for me.
For Robert, the fact that his brother lives nearby makes a big difference.
If there's anything I need, grocery shopping or helping me to get dressed, making appointments for me, he's there 100%.
You're good to go.
Caroline echoes that emotion.
My family has been fabulous. My husband is the best.
Her daughter Asia is a part of her support network as well, bringing help and a bundle of joy. When granddaughter Sophia arrives, it's always a special occasion.
Asia will bring me Sophia, and I'll just sit with her. She'll put her in my arms. I'll sit with her and feed her.
In addition to helping with everyday tasks, caregivers have an important role as observers. They might be the first to notice a change in the way medication is affecting their loved one, or they might see signs that the disease is progressing.
Do you have anything to add to what your wife's been telling me about how she's been doing?
Yeah, I think she's bumping into things a little more and almost tripping over things, and I think that's the major change that I've seen.
Caregivers are also on the front lines for any emotional or psychological issues that develop.
You know, sometimes it gets frustrating, and there's days I get, my wife will tell you, there's days I get real crabby and stuff, you know.
Parkinson's disease patients may suffer from depression. The people closest to the patient may see it first.
A caregiver can pick up the signs of depression. Is a patient eating well, they lose their appetite, they're sleeping poorly, they're moping around.
Sometimes the patient won't have noticed so much the change in mood, and the caregiver is very instrumental in bringing that change in mood to the physician's attention. Another thing is apathy, which is a loss of motivation or initiative. So unwillingness to leave the house, for example, or loss of interest in things that the patient used to be able to go out and do. And once again, the patient often isn't aware that there's been a change in motivation or initiative, and it's the caregiver who brings this to the attention of the doctor.
Caregivers also need to be aware of their own needs.
They can get burned out, they feel it's frustrating. Often, sometimes some caregivers say, well, the person with Parkinson's is not helping themselves enough. He could do it, but he's not doing it, and I have to do it for him.
I tell my caregivers right from the start, you need to take care of yourself, you need to go to the doctor, you need to get your own regular exercise. I want my caregivers to go out and be on their own, have activities and friends of their own that they can do without the person with Parkinson's disease.
Jackie has had health issues himself, so he and Caroline support each other. In fact, Caroline has taken up the bass so they can make music together. Jackie's advice to other caregivers is to let the patient do as much as possible.
Let them do it, and then if they can't, then jump in and and don't say, here, I'll take over. Just keep it normal. Try to just keep things normal.
There's stuff happening all over the place, and there's this new embrace of the brain as a frontier.
With the help of other advocacy groups and leading research institutions, the Michael J. Fox Foundation is committed to finding a cure for Parkinson's disease. Patients themselves can play an important role by finding out about clinical trials. The results from these studies can make a real difference in the care of future patients and provide more information about treatment options.
I mean, the buttons are in there. We just have to find them and push them, or give them whatever boost they need, whether it's gene therapy or some medical procedure that we don't know yet, some surgical procedure, who knows? But we're pressing the doors to find those answers.
If you've just been diagnosed with Parkinson's disease, remember that its effects and how quickly it develops can vary a lot from person to person.
You just have to start working your way slowly toward acceptance, which will take a while. And then you learn that acceptance doesn't mean resignation. It means you can be empowered to do all kinds of things to improve your situation.
For Caroline, that means positive action and a positive attitude.
You want to get up every day and say, what do I feel like I can do today? And then push a little past that. Try and go a little farther than that. Don't hold limitations on yourself.
John and Barbara are planning for a future that's as healthy as possible, with regular visits to the neurologist, an active lifestyle, and a positive attitude.
Parkinson's is not what he is. It's just something we have to deal with.
And just know that you're not alone. There's a whole community of people that are experiencing what you're experiencing, and we have each other, and we have our families, and we have hope.